International Society for Sports Psychiatry, or better known as the ISSP, aims to carry the science and practice of psychiatry to the athletic community. My name is Roy Collins. I'm a psychiatry resident at Stanford University and former collegiate football player from Yale University.
And my name is Somto Obi, a psychiatry resident at Baylor College of Medicine. This is the ISSP podcast, conversations around the intersection between mental health and sports.
Okay, welcome everybody. Today we have Dr. Shane Creado. Dr. Shane Creado is a board certified psychiatrist and sleep medicine physician. He actually first completed undergraduate degree in physical therapy before going on to medical school. Dr. Creado is finished his psychiatric residency and sleep medicine fellowship all at the University of Wisconsin. He is on the board of directors of the ISSP and the Registry of Sports Psychiatrists for the U.S. Olympic and Paralympic Committee. He hosts an Overcoming Insomnia course, which teaches the best evidence-based strategies to improve sleep, and is the author of Peak Sleep Performance, the cutting-edge sleep science that will guarantee a competitive advantage, which debuted at the #1 release on Amazon in sports medicine in March of 2020. Thank you, Dr. Shane. We are so appreciative of you coming and talk to us about the topic that is super important for health overall and sports and psychiatry, which is sleep.
Thank you so much for that warm welcome, and I'm happy to be part of this.
So first, why don't you just tell us a little bit about kind of how you first got interested in sleep medicine?
Yeah, so I started off with my residency at the University of Wisconsin Hospital and Clinics in the VA in Madison, Wisconsin. And one of my mentors was Claudia Reardon, who is a very well-known sports psychiatrist, and she really took me under her wing. I don't know why she did, but very grateful that she did. And the more I got involved in sports psychiatry, the more I realized that there was something really lacking in sleep, right? So when we talk about athletes, elite athletes, college athletes, they always focus on mental conditioning, which is super important. They focus on nutrition, they focus on physical training, but sleep is only thrown to the wayside unless there's a major issue, and then it's addressed. And when it is addressed, it's not always completely addressed. So the running idea is that, oh, you treat the mental health condition, the sleep issue should resolve. Well, the data suggests otherwise. They need to be treated concurrently and separately and completely. So I was appalled that athletes were being given Ambien, heavy doses of Klonopin, meds that may be banned by WADA if they go into the elite sports arenas. And so there's a real lack of a cohesive approach to sleep in the athlete. There's a lack of education among people who work with athletes, everyone from the nutritionist to the team doctors. There's also sleep coaches who say that they work with athletes. They may have just done a little certification or read a chapter in a book somewhere. And so it's really fragmented. And depending on what you do with it, you can go a long way with sleep. And the more I read about it, the more I realized that sleep is truly a performance enhancing tool. And that's why I wrote the book Peak Sleep Performance last year, because once I compiled this data and started working more in the field of sports psychiatry, and as you guys know, there's a huge overlap between mental health conditions and sleep problems. I realized there was a real great need for us in sports psychiatry especially to have an integrative evidence-based approach to sleep in athletes, not just when there's a problem, but to preempt things, to look for patterns, to look for teams, training schedules, travel schedules, in season, off season, preseason, and have sleep as a prescription, as a true weapon in performance. And that's how I got into it. So I felt great. There's a lot of information needed. I need to learn more as well. Then I did a fellowship in sleep medicine and the book, and more on the integrative side of things. So not just a medicine, but what are the underlying factors? What do hormonal imbalances do to sleep? What about the gut microbiome? What does lead toxicity in the water do to sleep? And so it's more of the holistic integrative, but also when needed, certain medications when appropriate. And I'm sure we'll come to meds versus supplements and all that good stuff.
Yeah.
Absolutely. Awesome. I think, that touches a lot of our questions about sleep. And at least personally, I know I've, snore and have problems with sleep. And I got, some treatment where I was able to sleep better. And I realized I've been drowsy for most of my life. But I think it's interesting topic to just touch on is, so what is it like when, people are getting sleep, and what, increase in recovery and performance can they see when they're starting to get more sleep, they're going through a better regimen, or like something, maybe prescribing one of your, plans for them? What would they see as improvements?
Yeah, there's a lot of great data and research being done. Actually, guys, at Stanford is one of the leaders when it comes to sleep research in athletes. So you're really fortunate to be part of that program for sure. So just to throw a few numbers out there, because I think data and those numbers, the statistics are important. Because if we say, oh, sleep is good for you, here's some pamphlet on sleep hygiene, you're really not going to buy into it. You need to know what it's going to do for you as an athlete, right? Where do I gain an advantage for in terms of working on my sleep? So Stanford University has done lots of sleep extension studies. So when we talk about sleep improvements, we say, okay, leave aside all the problems and correcting those problems. Let's talk about sleep optimization, not just normalization. So in terms of optimization, there are two main strategies that they've used in the research. One is sleep extension, where they've allowed athletes to get 30 minutes more of sleep every night. That's sleep extension. And in those studies, they've shown that basketball free throw percentages increased by 9%, three-point field goal percentage increased by 9.2%. Well-rested tennis players have a 4.2% increase in hitting accuracy. Well-rested swimmers show a 17% improvement in starting times. Well-rested football players dropped 0.12 seconds of their 40-yard dash. Split-second decision-making ability increases by 4.3%. And this has been seen across the board, from aesthetic sports to rugby to soccer to rowing. Across the board, we see performance enhancements in every domain. So peak performance, peak output, peak power output, perceived training load, perception of pain, recovery rates from injury, inflammation, thereby allowing quicker rehab. Those are big numbers in sport. And people who are not really involved in sport may think, well, what's 9% basketball shooting accuracy? But that's everything. You think about Michael Phelps, Milorad Kavic, for example, in the 2008 Olympics, 100th of a second was the difference between the gold medal and the silver medal. These are big numbers. That's just sleep extension. And when it comes to strategic napping, there's more data in support of strategic napping to boost performance. Whether it's female athletes, whether it's male athletes, in terms of endurance as well, alertness, cognitive functioning, your reaction times. Your reaction times can drop by as much as 300% with one night of sleep deprivation. And you think about risk of concussions. So if you're on the football field and you don't see the guy coming at you at the corner of your eye, your reaction time is a little slower, it increases your risk of concussions. And more data shows that you will have a harder time recovering from a concussion if you have been sleep deprived leading up to the concussion.
Wow. Wow. Thanks so much for those details on exactly what your performance can be. I think when we just think about what's common knowledge, people know that they feel better when they get a lot of sleep. But they also know that, or it may not be known, but when you do a formal sleep study, right, you're in a lab, you're being video monitored, you have machines hooked to you, you're kind of in a facility, as opposed to, where most of us are sleeping in our home beds, dealing with whatever daily stresses, daily activities we have. And so I wonder if you can give us more insight on to how to actually identify whether someone has sleep problems. I think back to being a student athlete myself, and did I have a sleep problem? I guess I was just busy. I had school, I had practice, I had workouts, but I don't know that I necessarily had a sleep disorder. So what are some signs, or what are some things someone could do without doing a formal sleep study, that might lead to them to doing a formal sleep study later, that would identify them having an issue in the first place?
Yeah, so that's a very good point, because not everyone deserves a sleep study. Not everyone needs an in-lab study as well. So you can ask yourself the following questions or ask your bed partner. Are you feeling sleepy during the day? Are you waking up refreshed? If you're not waking up refreshed, if you're feeling sleepy during the day or fatigued during the day, and there's a big difference. So fatigue is if you've had a big training session, you're exhausted, but you're not dozing off.
Mm.
When you're dozing off, that's when you're sleepy. So you need to be more tuned with your body with that, right? So is it sleepiness? Is it fatigue? Am I not waking up well rested? Does my bed partner say I'm snoring and they want to suffocate me with the pillow in the middle of the night, right? Or is my bed partner saying I'm thrashing around? Do I wake up and the sheets are all over the place, or I'm on the floor,
Mm.
or I end up in the basement because I'm sleepwalking? Uh, those are important considerations because if you're moving around in bed, it might be a parasomnia or restless sleep behavior disorder, REM sleep behavior disorder. It might be snoring, sleep apnea. There's also a different form of sleep apnea called central sleep apnea, where your brain doesn't regulate its breathing, so you may not snore.
Mm.
There might be narcolepsy or hypersomnia. And those are just the main sleep disorders, right? But if you're not waking up refreshed, functioning throughout the day, and then feeling sleepy appropriately at night, there may be something going on. So,
Mm.
when I say something going on, it doesn't mean the quantity of your sleep only, which is important,
Mm.
but the timing of your sleep as well. Wake up times, winding down before bed. And the third thing is the quality of your sleep. If you're not waking up refreshed and you're getting 9 hours of sleep, if you're an elite athlete, you're getting 10, 11 hours of sleep, still not feeling refreshed, tired, sleepy during the day, it might be a qualitative sleep issue. If any of those things are amiss and you're an athlete, now typical sleep screening tools don't apply to athletes. For
Mm.
example, the sleep apnea screening tool, the stop bang.
Mm.
Some of those criteria are age over 50, obese, so BMI over 35, a thick neck over 16 inches, hypertension. How many athletes fit that bill?
Right.
Hardly any. So we need unique screening tools tailored to the athlete. And there are two sleep screening tools that have been published. There's good data behind them as well. One is the Athlete Sleep Screening Questionnaire, ASSQ. That helps us determine which athletes would benefit from preventative measures. So, no major sleep issues. Okay, let's prevent any sleep issues. Then we can optimize them. And differentiates them from athletes which suffer from significant sleep problems. And then you can send them to appropriate care or a sleep doctor. And the other tool is the Athlete Sleep Behavior Questionnaire, and that's used to identify 40 sleep behaviors rather than sleep disorders. So that's where cognitive behavioral therapy for insomnia interventions can come into consideration.
Awesome. Thank you.
You're welcome.
Yeah, I think that's it kind of segues into our next question. For at least athletes, a lot of them might not know. Even us medical students, we learn about sleep strategies instead of using medications to get better sleep, like you said earlier, going to sleep earlier. What are other strategies, for say like an elite athlete to even an athlete that's in youth football or youth sports that they can implement without any like ecological like interventions to improve their sleep?
Okay, so assuming that there's no major sleep problems
Mhm.
and assuming that they're getting the amount of sleep that they need,
Mm-hmm.
because sleep is a recovery tool, right? With the right amount of sleep, your growth hormone levels will be boosted, your testosterone levels will be boosted, your stress hormone levels will come down. You will have less propensity for obesity, less propensity for hypercholesterolemia and diabetes and all that good stuff. So, assuming that someone is getting their recovery sleep, performing well, the other things we need to look at are, well, are they going to be put on any medications that can sabotage their deep sleep or their dream sleep? Because I want them to be in both. Do they have chronic pain, or do they have an injury that's going to affect the quality of their sleep? Medications like SSRIs can worsen restless leg syndrome or REM behavior disorder. Some of our antipsychotic meds in psychiatry can cause weight gain, worsen sleep apnea, worsen performance, especially heat tolerance. So I have an elite runner who's trying to make the Olympics, and this lady needed the Seroquel to function, to be stable, but it does affect the performance and worsens heat tolerance. More orthostatic hypotension, right? So that's going to lead to performance detriments unless we have a good balance between a holistic approach as well as medications for psychiatric and sleep overlay. I'm most concerned with the chronotype. So are you a morning bird or a night owl? Because even if you're not traveling across time zones, that's going to affect your performance. So typically, morning birds have been shown to have their peak performance hit 5.5 hours after their wake up time.
Mm.
Whereas for night owls, their peak performance is 11 hours after they wake up. And that performance difference can be as much as 26%. So when I'm thinking about, okay, this basketball coach, I'm working with a couple of the athletes on the team. You think about who to put in to the court right now. It's an evening game. I will tell him, okay, these guys are equal in talent. They're both kind of well rested. Who am I going to put on the court? The guy who's more of a night owl, because I know his peak performance is hitting at that point in time. And then, of course, when are the training times? So it's always better for a morning bird to train early in the morning. They get their performance peaking there as well, especially if they're competing at the same time, then it's a beautiful, beautiful harmony there. What about the training sessions? Are you going to have more training sessions, preseason versus in season? Are you going to train across time zones? How do I factor in their frequency of travel, their schedules when they're performing, their mode of travel, because plains are as dry as the Sahara Desert, how
Yeah.
many time zones are crossed, right? The time of arrival at their destination, the frequency of play, the turnaround times, the total in-game minutes, the time between the games as well. I need to factor in all of those things when I'm working with an athlete. Now, it's I do workshops, I do general education for athletes and teams, but then if I'm working with a team, I can work with their athletic director, their coaches, their managers in terms of, okay, this is their schedule for the season. This is what I think needs to happen in terms of travel, training times, and work with the rest of the team to do that. And then, of course, individual athletes, if I've identified a more serious issue, maybe an athlete needs way more sleep than other athletes. Maybe they have narcolepsy. How do I use strategic napping? How do I use other supplements that are approved by WADA to boost their performance? So it gets complicated, right?
Super complicated. And I just want to make a note that the chronotype answer you gave a little while back really spoke to me. I
Yeah.
had 3 years in college football having practice at 7 o'clock in the morning. And then my senior year, we switched to afternoon. And I thought that my performance, those afternoon practices were lights out different than the morning because I consider myself a night owl. So that does line up with 11 hours versus the 5.5 hours from wake up time.
It's such a good
Um,
point, Roy. I mean, if you think about it, what happens if a team is recruiting an athlete when
mhm,
they're at a 26% disadvantage compared to how they normally perform? That
mhm.
can decide whether you make a team, whether your career is made, or you got to do something else with your life, or whether you get the gold medal or you're not even on the podium.
Yeah, maybe that's why I was so bad my freshman and sophomore year.
Too hard on yourself, right? A typical athlete.
So I think whenever we've talked on it a little bit, but I want to get more into it. Whenever you talk about sleep aids like melatonin, Ambien, Lunesta, those type of meds are going to kind of come up, and a lot of primary care physicians and sports medicine physicians are going to feel comfortable potentially putting their athletes on them. So if I'm an athlete and I feel like I'm having sleep issues and the topic of sleep aid medications have come up, what would you say?
I'd say, why is the med being given?
Mm-hmm.
What med is it? What's the dose? What's the duration? So sleep can be regulated naturally. We have your homeostatic drive or your sleep thirst that builds during the day, and your circadian drive, melatonin peaking at night, cortisol uh, dipping, and then cortisol peaking early in the morning. Your growth hormone peaks in deep sleep in the first half of your sleep. Testosterone peaks around 8 a.m. So that's a rhythm there. So I'm curious to know what sets the rhythm to be disrupted. What's causing you not to sleep well? Is it pain? Is it mental health issues? Is it anxiety? Is it the busy brain? Is it bad sleeping habits? I'm interested in knowing all the underlying factors first before I even consider a medication, because medications, sleep aids, have dangerous consequences a lot of the time. And if I'm not addressing the underlying problem, I can worsen the situation. So when it comes to sleep aids, there's over-the-counter medications,
Mhm.
typical Benadryl, antihistaminics, but those ones can become addictive
Mm.
and they can slow you down. Antihistamines, all the over-the-counter sleep medications can worsen restless leg syndrome and can cause quality of sleep to be impaired.
Mhm.
And they actually reduce, sure, they block histamine, but they also block acetylcholine, right? And acetylcholine is a major neurotransmitter for memory and the main one implicated in Alzheimer's kind of dementia. So in long-term studies, there's an increased risk of dementia. Same with the benzodiazepines. Long-term use, addictive potential, tolerance, and risk of dementia. But not only that, even the prescription sleep medications, they stop working quickly. Most of them have an FDA black box warning because there's parasomnia, sleepwalking, sleep talking, sexsomnias, which can get people into legal trouble. That's a whole different topic. It
Mhm.
can result in daytime sleepiness, brain fog, worse performance, athletic performance, lower energy, slower cognitive performance. And they're not specific. It's like using a carpet bomb rather than a precision strike for the underlying issue.
Mhm.
And
Mhm.
we think about sleep, when we think about insomnia, insomnia, the way I look at it is not a lack of sleep, but an excessive wakefulness of the brain.
Mhm.
And sleeping is the most vulnerable thing we do. So if your brain isn't managing to calm down appropriately, is it something you're doing wrong, just expecting your brain to fall asleep as soon as you want it to? That's not going to happen, right? Your brain is
Right.
not a light bulb.
Right.
And melatonin is always misused. So that's the other thing I want to talk about when it comes to over the counter stuff like
Please,
melatonin.
yeah. Yeah.
People always ask me about melatonin, so I thought I'd address this as well.
Mhm.
Melatonin is simple if you know what it's supposed to do. It's only supposed to nudge your brain into sleepiness,
Mhm.
not supposed to knock you out. And
Mhm.
typically, the doses in sleep medicine for falling asleep tend to be less than 3 milligrams, usually 1 or 1.5 or 2 milligrams. And in fact, a 3 milligram dose of melatonin can increase your body's blood levels to 10 times those of normal. So
Mhm.
when we get 5 and 10 and 15 milligrams from CVS and Walgreens, what do you think is going to happen? It's going to
Right.
accumulate, it's going to have an opposite effect in your brain, it's going to wake you up in the middle of the night, and you're going to feel like a zombie when you wake up. So that's a bad way to use melatonin. If you want to use melatonin, if you're having trouble falling asleep, you can use maybe 1 or 1.5 milligrams 90 minutes before your desired bedtime.
Mhm.
And there's some other helpful supplements that you could use instead of medications. And some of my favorites are 5-HTP,
Mhm.
which gets converted to serotonin,
Mhm.
GABA, which is a calming modulator there,
Mhm.
L-theanine, another really good one, B6, vitamin B6 helps produce a small amount of serotonin. It's a cofactor there. Lemon balm extract has been shown in some good studies to help calm the brain down, help you fall asleep.
Wow.
Valerian root is actually particularly effective for staying asleep, especially in menopausal women. But most people hate the smell of valerian root, so I tend to avoid that. Magnesium is a really good one too, because it helps potentiate deep sleep. and chamomile tea as well. But the doses need to be right. Right? If you're talking about a medication or talking about an antibiotic, it's important to know the dose that you're prescribed. And similarly, most people spend tons of money on really poor quality supplements. There's no real good FDA oversight on supplement manufacturers. So you got to trust some good companies who make good quality products, who have their reputations on the line, and the right doses and the right combinations. So I got my feet wet in the supplement arena last year. Well, 3 years ago, when I started working on a sleep supplement for this company called Brain MD, and I got to learn a lot through that experience about the supply chain, the raw materials used, the kinds of doses and how they interact with one another, even the form factor of the pill. Apparently, there's a psychology to that. So it was a really good experience for me. And be careful with the doses and the sources you're getting your supplements from. But in the right hands and the right doses, they can be extremely effective. As long as you're not waking up drowsy and miserable the next day, they can help potentiate your deep sleep and dream sleep, depending on the supplement.
That's super helpful, and we'll definitely at the end make sure we have good resources to understand all of that. But I want to pinpoint something that we've talked about a couple of times, just for making sure all the different parts of the audience understand what we're talking about. So when we talk about restless leg syndrome, how do we differentiate that from just someone who is anxious and antsy at night?
Okay, that is an awesome question. Restless leg syndrome is a sleep condition and it is a clinical diagnosis. You don't need to go into a lab or get a sleep study for the diagnosis. Three criteria. Yes to all means you have restless leg syndrome. One is a weird sensation in the legs. It might be a little pulling, it might be a little irritation deep inside the legs. That's worse at night, that's relieved with movement, and worse with long travel time. So if you're sitting still for a long period of time. So if it's yes to all those, congratulations, you have restless leg syndrome. Now,
Surprise.
the thing is, it's you don't need to be on a medication initially for that either, unless it's severe. So although it's restless leg syndrome, it tends to be a misnomer because in severe cases, your hands can be moving as well, or you feel irritable and you feel like you need to move them in order to relieve that sensation. One of the most common reasons people have restless leg syndrome is a ferritin deficiency or a storage form of iron. So I would say if you're having those kinds of symptoms, get your iron levels checked. Make sure your ferritin levels are above 75. I don't care about what normal is, I care about what optimal is.
Mm-hmm.
Look at your vitamin D levels. I want to see your vitamin D levels over 60. I know normal ranges are 30 to 100. I want to see them over 60. Helps you with quality of sleep. Rhodiola and magnesium that I mentioned already are very beneficial for restless leg syndrome. So if you correct those issues, restless legs, in a vast majority of people should resolve. If they don't, it might be a medication. Most SSRIs can worsen restless leg syndrome. Eliminate stuff that worsens it. And then, of course, if it's still an issue affecting the quality of your sleep, then we might consider meds like gabapentin is a gold standard med right now for restless legs.
Mm-hmm. Thank you so much.
Awesome. Yeah, so our next question is, I know in your book, Peak Sleep Performance, you go into elaborate more on these next two questions, but at least for, athletes, what are some things that we might not know might affect your sleep? Some things that are straightforward, like caffeine, that they might need to be aware of. And then also what's going down in the pipeline for new innovations, new things in sleep that, we should be looking out for.
Yeah, absolutely. The one thing athletes do is you want to do everything you can to boost your performance, optimize. You will work as hard as you can to get to the next level to have a competitive advantage. Right? There was even a study done many years ago that there was a survey. Olympic athletes were asked, well, if you could have a drug that would allow you to get a gold medal, never be detected, would you do it? 100% of them said yes. And then the next question was, well, if you know that the drug is guaranteed to kill you within 5 years, would you still do it? 60% of them said yes.
Wow.
So sleep doesn't do any of those things, thankfully, right? Sleep will only
Thankfully.
naturally boost, thankfully.
Wow.
So athletes need try too hard. That's the first thing. And sleep is
Mhm.
something you need to allow to happen. That's why we say fall asleep, not go to sleep. Make yourself sleep. So the harder you try, the more likely you are to fail because the harder you try, the more wakeful your brain becomes. The same with clock watching. When you watch the clock in the middle of the night, you are trying too hard. So Viktor Frankl spoke about paradoxical intent in his book Man's Search for Meaning, where it says he talks about letting go. He talks about social anxiety, hyperhidrosis, and insomnia. So athletes need to let go and allow the process to happen. And the sleep position, most people don't know this, but the best sleep position to be is on your non-dominant side, especially if you tend to be more anxious. So I'm right-handed. My best sleeping position is going to be on my left side because subconsciously your brain thinks, oh, if someone comes to attack me in the middle of the night, my dominant hand goes up to protect me. You'll feel safer on your non-dominant side, usually in the fetal position. Weighted blankets can help calm the nervous system down as well. Unless you're claustrophobic, then don't do it, right? And weighted blankets need to be 10% of your body weight. When athletes travel across time zones, they sleep in hotel rooms, and it's a different sleep environment. So it can really disrupt your sleep. So for some of my athletes, and this has been done with cycling teams when they perform in Tour de France and other places, they actually have sleep kits, hypoallergenic materials, a few layers, washable, quick dry, and they actually take them with them wherever they go. They roll it up like a gym mat, go wherever they go, and they use that instead of the hotel bed or put it on top of the hotel bed if it's not too soft for consistency in your sleep environment. I've had a couple of my athletes who had really awful hotel rooms with light coming through the window actually get black garbage bags and put them on the window, tape them up there so that it's complete blackout effect, because even light coming through the chinks in the windows can reduce your quality of sleep by 68%. Those are a few things people don't really think about or talk about, but it's important. Mattresses and pillows. People spend thousands of dollars on mattresses and pillows, but it's really simple. A pillow is not supposed to, a mattress is not supposed to make you sink into it.
Mm.
Mm.
And a good way of knowing about whether a mattress is too firm or too soft is to do your side sleeping position, non dominant side, have somebody take a picture of you from the back, and then you kind of know. So if your body's sinking too deep into the mattress, then your head is level. You don't need a pillow, and you're like, that's too soft. Or if it's too firm, then your head kind of flops down too far down, more than two hand spaces, and then
Mm.
you know that okay, that then it's too firm. So
Mm.
you need something in between. And all a pillow's job is, a pillow is not essential. A pillow's job is to fulfill that little gap between your head and your shoulders in side sleeping position with the right kind of mattress. I don't care how much it costs. If you're doing that, that's the right position, the right mattress and pillow for your needs and your spine.
So me using two pillows last night was probably an indication that I might need to change up my mattress.
Get someone to take a picture of your back, and yeah, you'll see whether it was too much or not, right?
Yeah, mine is definitely more soft, so I'm like sinking in every time. So I need to fix that.
Yeah, and one thing you also asked me was, what are the innovations
Innovations,
happening,
exactly.
right, in sleep medicine? So I wanted to come to that.
Mm.
There's plenty of innovations, and I'm so happy to see how far we've come so far. But I'm always cautious. I always want to wait until there's some good studies to support certain interventions, certain tools, certain strategies for sleep. Another big problem is people start obsessing over their Fitbits and their smartwatches,
Mhm.
and that's the wrong way to go. I host a bi-monthly sleep Q&A on this social media app called Clubhouse, which is a relatively new app, and I'm always like, almost every time asked about sleep trackers, and I say what's way the best sleep tracker is you. And the
Mm.
best way to do that is the old fashioned sleep diary, where you wake up in the morning and just estimate what time you fell asleep, what time you woke up, and how much sleep you think you got.
Mhm.
because a few years ago, when I was doing my training in sleep medicine, there was a study that compared 10 different sleep trackers. And they said, well, okay, how accurate are these at detecting REM sleep or deep sleep? And they were right in detecting dream sleep 3 out of 10 times. That's
Wow.
worse than tossing a coin.
Wow.
Now the data has improved, and the good news is that these companies are actually consulting with sleep doctors, so they're calibrating them more
Hmm.
accurately, similar to the actigraphs that we use in sleep clinics when we send a patient home with a sleep monitor. So now there's better and better accuracy when it comes to the sleep trackers. That's one area. The other area is, what else are we using to help your brain calm down, to allow you to fall asleep? Non medication routes. One of those is binaural beats, some good studies there. Some people use white noise, bad studies there. Don't waste your time and money doing that. Okay. Weighted eye masks can induce some sort of comfort, like the weighted blankets can boost oxytocin, the cuddle hormone. You feel more safe. Some great meditation apps to wind down before bed are available. And there's some neurofeedback apps like HeartMath, where you train your brain, like this little ear dongle and an app on your phone, and you train your brain to calm down. There's breathing research also. I like the 336 breathing technique, where you where the 336 breathing technique involves in through the nose for 3 seconds, hold for 3 seconds, out for 6 seconds, and that actually helps your parasympathetic nervous system take better control. So it's something that is taught to snipers in the military so that they
Hmm.
can lower the heart rate and be more accurate. So there's lots more research underway, and especially I'm excited about AI and machine learning for
Hmm.
interpreting the results of sleep studies, because there's a severe shortage of sleep doctors, sleep technicians. And so when we use AI and machine learning with the right algorithms and the right thresholds in place, then we're going to be able to tailor to a lot of patients, way more than is currently being done.
Wow, that's all super incredible. Dr. Credo, you've given us so much information, way more than we can cover in one interview, and I want to be conscious of everyone's time. So if someone wanted just a easy understanding of everything from supplements to some good sleep strategies, where could they go? What resources could they find just to better educate themselves?
Okay, be careful where you get your information, right? Because as the saying goes, we're flooded with information but thirsting for wisdom.
Hmm.
And it's not sleep hygiene as we've discussed today.
Hmm.
So I would say that that's why I wrote the book. I wrote the book because it's here behind me. So Peak
Perfect.
Sleep Performance for
Perfect.
Athletes is available on Amazon and Kindle. And it's basically all the sleep strategies I use with my Olympic athletes for everyone to have access to. So I
Okay, cool.
cover the prevalence of sleep issues, sleep impairments in terms of overall health, performance uh, detriments, as well as a cohesive strategy to screen yourself for sleep problems, and then all these tools, including the humidity and the temperature of your room. How do you choose the right mattress? The sleep supplements and doses, travel strategies to shift your rhythm so you arrive in Tokyo for the Olympics this year at your
Hmm.
peak. It's all covered in that book. And my Instagram is Peak Sleep Performance. I have a
Hmm.
lot of tidbits, includes like the Peak Performance coffee that I drink every day with a bit of chili powder and a bit of cinnamon inside. I explain the
Ooh.
rationale behind that. Yeah, just a little bit, not too spicy, okay?
Okay.
So those are good resources, people. And of course, my website, shanecreado.com. Happy to connect with anyone. And of course, Clubhouse, where I do the bi-monthly Q&As for anyone who signed up for Clubhouse. And if people need invites, I have plenty of invites. I don't know why Clubhouse gave me so many invites, but I have a few to go around. So hit me up through my Instagram, DM me, and I'll help you out.
We'd also
Thank
love to
you.
have you back on the show at some point. You know, I feel
Yeah.
like there's so much more to explore. We want to get down to the nitty gritty and help people better sleep and perform and do all that kind of stuff. So hopefully we'll have you back and we can talk more in depth.
It'd be a pleasure because I know we have such limited time, so many topics, and each topic we can go into specifics. I can just give you practical, applicable strategies to take home with, right? Happy to do it, guys. It's been a pleasure.
Awesome. And we'll be sure to have your information, how to connect to your website and everything when we post the episode. Thank you so much, Dr. Creado.
Thank you.
Thank you, Dr. Creado.
Thank you so much for watching or listening to our content today. Please like and subscribe to our YouTube and podcast channels and share this episode with your friends and colleagues. Also, follow us at Sports Psych ISSP on Twitter and Instagram, or you can find us on Facebook as the International Society for Sports Psychiatry. Are you a medical student, psychiatry resident, fellow in a psychiatry subspecialty fellowship program, or a psychiatrist who has completed a psychiatry residency program interested in learning more about sports psychiatry? Join us and become a member of the ISSP. We have a free open source certificate of additional training in sports psychiatry program. For more information about our certification program, membership, or other inquiries, go to our website at sportspsychiatry.org.